Okay. Number 5. Write sentence to describe the work of the specialist in each branch of medicine. Look at B opposite to help it. Dermatology. A dermatologist specializes in diseases of the skin. Rheumatology is a specialized in diseases of the joints. Traumatology is specialized in accident and emergency medicine. Pediatric is specialized in diseases of infant children. Obstetric is a specialized in managing in pregnancies. Okay, number 2. Okay, complete complete the table with word from A, B, and C opposite and relate form. Put a stress mark in from the stresses syllable in each word. The first one has been done for you. Verb non person, non activity of thing. Specialized, specialist, speciality. Practice, practitioner, practice. Consultant, consultation. Assistant, assistance. Graduate, graduation. Qualified, qualification. Okay, number 3. Acá. Find preposition in C opposite that can be used to make word combination with the word in the box. Then use the correct form of the word to complete the sentence. A pathologist specializes in diagnosing this through examining cell and tissue. A pediatrician, okay, excuse me, must enjoy working with children. An oncologist is interested in the diagnostic and treatment of cancer. A psychiatrist must be good at counseling. A neurosurgeon must be good with her hands. Make word combination using a word from each box. The word can be used to look at B, C, and A, B, and C opposed to help you. This is number 4 acá. Okay. Okay. Consulting rooms. General practitioner. Grow practice. Health center. Internal medicine and surgical specialist. Continue. Okay. 6. Make word combination using a word from each box. Look at A, B, and C opposed to help you. Associate specialist. House, office. On call. On call. Provisional diagnostic. Cardio page. Ward round. Number 2. Okay. Match the description 1 and 5 with the job titles. A and E look at A and B opposed to help you. Dr. Graham has been pediatrician for 8 years and is responsible for training the children admitted to Ward 30. 60, 60, 60, 60 or 80. Okay, and is number is consultant. Dr. Stewart has just started the second year of the foundation program. SHO. Dr. Singh has started his training as a surgeon, specialist register. Dr. Phillips has just graduated and is working in a large hospital in Birmingham, PRHO or house officer. Dr. Milan is in charge of the medical staff in the Birmingham Hospital. Medical director. Okay, number 60.3. Are the following statements true or false? Find reason for you answering A, B, and C opposite. A medical graduate becomes um, registered 2 years 2 years after graduation. False. The system of training doctor in Britain is called the Foundation Program. True. The name senior house officer is no longer used in Britain. False. The consultant is usually the first doctor to see new patient. False. When working in shift, a doctor takes turns to be on call. False. Number 4. Complete the test of a PRHO describing her job. When I get when I get to the work, the first thing I do is talk to the house officer who was on during the last shift to find okay to find out if there have been any new admission. Then I generally see the change nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, clerk any new patient with basically involves talking histories. On Tuesday and Friday morning, the consultant does her work around, and I have to make sure I'm completely up to date or her patient. After that, after that, there are usually lots of things to do. Like writing of requests for blood test, and so on in the afternoon. I have to prepare for any patients who are to be discharged. The next day, they usually happy to be going home. And then, of course, there are the lecture and tutorial in the foundation or training program on Monday and Wednesday. Okay, number 7.1. Okay, okay. Say, complete the sentence. Look at A, B, and C opposed to help you. Someone who specializes in the delivering babies in midwife. Some someone who is qualified to assist a nurse, clinical support worker, someone who is not qualifi- qualified, qualified, but is able to assist a nurse is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in the health promotion is a health visitor. A nurse who looks after a ward is chief Nurse is a shared nurse. A nurse who works in the community is district nurse. Someone who answers the ward telephone is a ward clerk. 2. Carry out, pardon, make word combination using a word or phrase from each box. Carry out a procedure. Change a dressing. Check the temperature. Give an injection. Remove sutures. Okay, continue. On number 7, okay, complete the sentence with the correct grammatical form of perform. An isotope brain scan is a painless and easy perform. Biopsy of the pancreas was performed last March. If the patient condition deteriorates, a laparotomy should be performed. If a diagnostic of meningitis is suppressed, a lumbar puncture must be performed. Last year we performed a randomized double-blind group study. Number 4, justo acá. Yes. Complete the sentence with the correct grammatical form of carry out. I now intend to carry out a large study. 2. Unfortunately, new unfortunately few properly controlled trials have carried out so far. A number a number of studies have been carried out recently to look at this question. A right hemicolectomy has been carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Okay, continue. Number 8. Number 8. Make word combination using a word from each box. Okay, ambulance, ambulance, technician, artificial limbs, club, food, contact lens, health professional, intraocular pressure, occupational therapist, social worker. Okay, number 2. Which alien health professional could be help the following people? 1. A young unmarried woman who has just had a baby, social worker. A woman who is having difficulty using her right arm following a fracture, physiotherapist. Someone who needs glass, optician. An elderly woman who has had a below knee amputation prosthetics. Okay. 5. A man whose wife has Alzheimer's disease, occupational therapist. A man with a fungal infection of his feet, chiropodist. Chiropodist. Number 3, this. Okay. And complete the test. Look at A and C opposed to help you. A protective work with patient of an age is as a member of clinical team based at a large hospital. The patient may need a prosthetic as the result of accident or on amputation. Okay, following a disease such as diabetes, Alternatively, they may have been born without a limb. Authorities work alongside doctor nurse, physiotherapists, and occupational therapists to give the people under their care the best possible. Rehabilitation they remain aimed to enable the patient to lead a normal life at work and leisure. And authorities often work in a clinic as part of an outpatient service and also visit other centers to provide a service for people with special needs. They deal with people of all age. For instance, children who have cerebral palsy may require split to help them walk, and many other people need a special shoe to correct deformity or deformities. If damaged any part of the human skeleton may require some form of orthis. The orthis may be needed to reposition the body or relieve pain. Okay, continue. Number 9. Okay, complete the table with word from A and B and C opposite. Okay. Verb noun. Admit admission. Access accessment. Discharge discharged. Operate operation. Refer referral. Treat treatment. Make word combination using a word from A box. Look at C supposed to help you. Okay. Ocularity ill. Asthma unit. On duty. Referral letter. Waiting list. Okay. Which hospital department will be most appropriate for the following patient? Look at A, B, and C opposed to help you. A woman in diabetic coma intensive care unit (ICU). Okay, a patient who has just had a radical prostatectomy, high dependency unit. A patient who a patient who is to have a skin lesion removed, day surgery unit. A man with a foreign body in his eye, the accident and emergency department. A woman with a threatened abortion maternity emergency. Okay, continue. Complete the extract for an information letter for patient. Okay, information for outpatients. When you arrive at the clinic, please tell the receptionist who will welcome you. Check your detail and direct you to the way area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests done, such as an X-ray, which could mean going to another department, or you may refer of the professionals such as physiotherapists or dietitians. You may need to revisit the clinic in staff at the clinic want to see you again. Another appointment will be arranged for you if you needed to the admitted to hospital for more treatment, either either as an inpatient or for the surgery. You will be told when this is like to happen. If you do not need further treatment, you will be discharged to your GPS care. Okay, then complete the sentence. Children over 60 and people with some chronic disease do not have to pay prescription change in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is leave. Care outside working hours is known as out of hours treatment. Make our combination using word or phrase from each box. Okay. Change dressing. Make appointment. Make home visit. Perform minor surgery. Prefer a patient. Room a clinic. Supervise staff. Take messengers. Which member of the practice team will be responsible for each of the following? Running a clinic for pregnant women midwife, teaching a patient how to straighten his broken leg physiotherapist, letting the GP know that a patient can come to her appointment receptionist, running a clinic for people who want to lose weight practice nurse, visiting a patient who has just returned home after a hernia operation district nurse, carry out checkups on children in a poor neighborhood health visitor, organize, organizing cover from an absent doctor practice manager. Complete the diary for Dr. Stewart afternoon. Look at A and C opposed to help you. Practice team meeting over Sunday lunch, afternoon surgery. 11, 12, 10 minutes appointment. Coffee break. Check visit reception for messengers deal with home visit and repeat prescription records. Paperwork, AG, referral, los secondary care admit tax. Telephone calls to patient private medical examination. Phone is watched net to OOH service. Okay, continue. Okay. Match the activities to the stage of medical education in the UK, given in a post, researching cadavers, undergraduate, keeping a log of surgical procedures, observed and performed postgraduate, working for 4 months in accident and emergency to experience this specialty foundation program, taking a 4-week assignment in obstetric and gynecology undergraduate, taking advance on course of the researching developed in the cardiovascular this continuing professional development. Complete the sentence. You just just before their final year, students have the chance to take a elective in a hospital of their choice anywhere in the world. So problem-based learning contrast with an approach where each subject is taught separately. These days, lecturers are often interactive with regular opportunities for the student to ask questions, In clinical attachment, students learn how to treat and manage patients. Students select modules. Can be a topic from outside medicine, such as foreign language. Dissection of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatric care specialists in the country. The Royal College of the Surgeons is Edinburgh's date from 1505. We have a seminar can week where we discuss topics in a small group with a lecturer. Match each of these activities to one of the components of the undergraduate course, described in B and C post. Julie spent 6 weeks working in a small hospital in the Himalayas, overseas, overseas elect. A group of students discussed together the possible reason for abdominal pain after meal in an over for a 44-year-old man. Problem-based learning. A small group of students trains the pulmonary artery in a cadaver dissection. Also spent a month working in the pediatric ward of the local hospital clinical attachment, and he learned how to take blood from an elderly patient. Elderly patient. Okay, clinical skills. You must choose to study travel medicine in his 4 year student select model. Okay. Complete the phrase with the verb from the box. Demonstrative, a competence or how to do something. Supervise, a training by ensuring the successful completes her training. Delivery, deliver a course of the training program as a teacher. Log, a course of training program. Access, program of competence. Okay, match the two portions of the sentence. N, F, N, and A, Y, one is a doctor in the 5th year of the foundation program. A demonstrator is an anatomy teacher. Okay, who teaches this section? A clinical trainer is a consultant who provides training during periods of direct clinical care. A supervisor is a consultant responsible for the training program of a trainee. A medical school is part of the university responsible for medical education. A placement is a period spent as a trainee in a hospital or in general practice. A college is a, a body of specialists responsible for delivering and assessing training in their specialty. A fellow is a specialist who has reached, his head level in the specialty. Gratefully, grateful the qualification of the doctor and surgeon. Mr. A. H. Young Husband, MBCHB, FRCS, FRCSI, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of Australia. Number 2, Dr. C. Doy, BMADSCI, DMMRCP. Bachelor of Medical Science, Doctor of Medicine, member of the Royal College of Physicians. Mr. E. English, MBB, FRCS. Bachelor of Medicine, Fellow of the Royal College of Surgeons of England. Dr. E. Meriwether, BM, MD, FRCP. Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. Okay, continue. Okay. What kit, what kit of registration means the doctor obtain? Look at A supposed to help you. A newly qualified Spanish doctor provisional registration. A newly qualified Nigerian doctor limited registration. A doctor who has successfully completed the first foundation year if Y1 full registration. An SHO who has successfully completed the foundation program and gained a certificate of a completion of training after several specialist registered post specialist registration. Two, okay, two. Write the abbreviation in Word. Look at A, B, and C opposed to help you. Any doctor who wants to work in the UK must register with the HMC, General Medical Council. Some overseas doctor must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. Part 2 of the test consists of the OSCE, Objective Structured Clinical Examination, and any emergency, remember the ABC protocol. Airway breathing circulation. Before you can obtain a specialist registration, you must have a CCT certificate of completion of the training. Here, complete the text. My name is Musa, and I come from Yemen. I came to the UK about 2 years ago after graduation. Because Yemen is outside the EEA, I could only I could only obtain limited registration with the CMG. At first, it was very difficult for me to obtain a place on a foundation program. Although it speak good in English, I had to take the PLAB black test to show that I could work safely in the UK if I had to give some advice to other candidates. It would be that or at counseling station you should simply memorize a set or phrase. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO in my shows, especially pediatric. As hospital, as a hospital now have to demonstrate there is a suitable candidate for the EEA. Once it complete my second foundation year, I shall obtain a OCT which will allow me to proceed to a special registration with the HMC, an important step on the road to become a pediatric consultant. Okay, finish. It's a pleasure. Okay, goodbye.